Hey everybody, Dr. Bulow here with Revive Upper Cervical Chiropractic, and today I wanted to talk to you about learning disorders and different conditions that affect kids when they're going back to school. All month long we've been talking about back to school, and hashtag Revive Back to School is just topics that deal with these kids and conditions that affect their ability to learn and engage and socialize. It's really important information, so I appreciate you taking the time to take a look at this. So with that said, let's talk about the role the neck plays in some of these conditions. What are some of these conditions? We have ADD and ADHD, right? Fairly common, fairly well known, but also learning disorders and focus, autism spectrum disorders. A lot of these conditions are inability of the brain to process information. Headaches, of course, and anxiety. Well, it has to do with the fact that your neck does two very important things for your brain. Number one, it helps to stimulate the brain, and number two, it helps to ensure proper blood supply to the brain in and out of the skull. Two really important ingredients for proper brain function is stimulation and blood supply. So let's talk about stimulation. Your brain, how alert it is, how awake you are, is in large part thanks to something called the reticular activating system, or the RAS. The reticular activating system is what regulates and makes you aware. If you have a really good quality reticular activating system, not only are you fully alert, but you're also very selective of the information that you're conscious of. Many of us have already forgotten that we are standing on the soles of our feet, or maybe you're sitting in a chair right now watching this video, but you don't even feel the pressure under your feet or under your butt. That's because the reticular activating system has decided that information is not that important. You don't really need to be aware of that right now. Two things can go wrong if that reticular activating system is not healthy. Number one, you may not be to the level of alertness that you need to be. You might be fatigued. You might have a mental fog. You might be frustrated. You may not be able to recall words the way that you want to recall words. Or you may be overstimulated. You may be processing too many things that your brain would otherwise not really be all that concerned about. And what stimulates that is your spinal cord, your sensory receptors, and all of those, most of those, go through the neck to get there. So a neck problem, a neck misalignment, can limit the quality of this reticular activating system, which will then turn down or overload the rest of the brain. The other thing, which is kind of obvious and important for the brain, is proper blood supply. Oh my goodness, so important. And what some people may or may not know is that a lot of the blood supply to the brain comes through your neck, and the latest research has shown that you can in fact have a misalignment in the upper neck that can in fact block or cut off the flow of blood in and out of your skull. In particular, it can compress the internal jugular vein. Pretty important stuff. And if your brain doesn't have proper blood supply, that means not enough oxygen, not enough nutrients, and a buildup of waste products. Now we're talking about headaches. Again, that mental fog, chronic fatigue, trouble thinking, trouble recalling words. If your child's coming back and they can't focus and they can't take that test and they have a headache and they're only 10 years old, these kids shouldn't have these problems, right? Every once in a while, we can accept these problems. But on a chronic level, we have to step back and say, okay, instead of treating this body from the outside in, what does this brain need to do to run well? Maybe we can look at the neck. Maybe it's not a coincidence that a lot of these kids had cesarean section births where their heads were pulled. Or maybe they play hockey at a young age and they got their head banged around. Or maybe they fell out of the tree when they were playing last summer. Or maybe they ran their bike into the tree when they were learning how to ride a bike for the first time. It's not a coincidence, and this is the things that we want to look for in our kids. Some good information, hopefully you find some value in it, right? If you have any questions, please don't hesitate to ask. And most importantly, if you have a child in your life that you think this may be an issue, right? We would love the opportunity to help you. If you're within the greater Pittsburgh area, Western Pennsylvania, you can see us here at our clinic in Cranberry Township. If you're outside of the area watching this, please contact us all the same. We will find you a specialist in your area that does this particular type of work. Very precise, very gentle. We love to be able to help. Otherwise, thanks for spending the time, and we'll see you guys again real soon.